Good morning from wherever you are watching us from. It is Wednesday, the 9th of December, and the health workers' strike is set to enter its third day, and focus shifts to lack of leadership from the political class that is yet to offer leadership. KTN continues its day-long coverage of the strike, talking to various stakeholders as amid a looming health crisis. On Morning Express, we talk matters universal healthcare today. That was yesterday, actually, but today we shall be focusing on all matters relating to this, as has been covered by the local press. And this is a matter that has been dissected quite deeply, and I shall be having Alex Makesi, governance expert, joining us this morning to help us dissect some of the stories that have been covered by the Standard newspaper as well as other local papers. So stay tuned for that. We also shine a light on gender-based violence in our black and white segment later on. So let's get on with it. Let's talk about what's making headlines locally. Welcome to the show, Mr. Makesi. Mr. Makesi, can you hear me?
Yes, I can hear you. Good morning. How are you today?
Yes, I can hear you too. I'm good. And I'd like us to just jump into it. The biggest story has to do with the health sector. Now, we are being told this morning up on the front page of the Standard about how one Mike movie Sonko is walking in the footsteps of Babayo. We all know what happened, and I'll read a small excerpt from that particular story. We are told about the same script, just different cast. Through hard play and popular antics, the pair, those two, we have Mike Sonko being the latest. They came to the table of politics through high-stakes politics, but their monikers Babayo and Sonko became similar to their names, and now some say they took their jokes too far. Waititu was booted by Kiambu MCAs on the eve of Christmas last year, and the question is, being this is a similar time as when Waititu was thrown out, is this the same fate that Mike Sonko shall be facing? So on page 8 you can get more details about this particular story and the analysis and the comparison between the two. But I know you have gone through this story. What do you make of it?
Well, it's interesting that we are actually at this particular position because, well, as they just been rightly put, how these two gentlemen came into power was out of pomp and flair. They were the starlights, the leading starlights of the Jubilee Party at the time. They seemed to be the people who were leading the masses in terms of bringing people towards the Jubilee Party, and they were able to transcend all other metrics that are normally put forward for a politician, and were able to take power. But as they took office, you could see that there was a lot that was lacking in terms of integrity, how they were running their government.
Yes.
And it became no surprise that it ended up in this scenario that we're in right now. And to find that Sonko is presently going to face an impeachment similar to what happened to his friend, leading governor. It shows that at some point the party can come to an end, and this is what is happening right now. I think for us, what we should be really looking at is how the Senate will look into the matter of Sonko. Already the issue of having an 11-member committee look into his particular impeachment was let down yesterday, and now we're looking at a plenary session that's supposed to happen. The judgment is out there. I know him being a former senator can be something that can be put to play. Also, the issue that he doesn't have a substantive deputy could mean that some senators would be uncomfortable with the issue of having him removed, because it would effectively mean that we might go into a by-election in Nairobi, and that has been said that it's not something that's a priority for political actors at this particular moment. So it is going to be a case that we will have to really skillfully look into and study. It is unprecedented to be in such a scenario whereby you have a governor who has been impeached via Zoom, and a lot of people have questioned whether that was a real impeachment or not. And then second, then you have a scenario whereby he's a governor who does not have a substantive deputy, and numerous court cases are in court trying to assess whether he can be able to state that the fact that he had nominated someone that became a substantive nominee for deputy governor.
Yes.
Yesterday, so a judge recused himself over the matter of Sonko because it was alleged that he had received a bribe. So, you know, it's a very interesting case, and we are going to see what the senators will do over the next 2 days and how they will handle this particular matter.
The nation is terming the move, the twist in Sonko's impeachment as an unusual move that will have, of course, Senate Majority Leader Samuel Pogiso failed to table a motion that would have culminated in the formation of a committee that would have investigated the governor. Sonko will now face the whole House. What do you make of that, the twists and turns in this process of his ouster, basically?
I think this particular matter reads like what was in the Waititu case, that whereby senators feel that they working just through a committee, a select committee, would not be sufficient enough for them to prosecute the matter concretely. And so I wasn't surprised to see that Pogiso bypassed that particular motion, and in effect having the Speaker communicate that over the next 2 days the matter will be considered in plenary. I think everybody wants a piece of this particular action, and because it's an interesting case, and a lot of people would be interested to participate in it. However, there is another question that came into the Senate yesterday as to whether who exactly should be able to be allowed to vote on that particular matter. Should it be members who are actually present in Bunge, or can it be done through people who are sitting in their homes, senators sitting in their home via Zoom? And a lot of them have been of the opinion that it's only for the people who would be present in those sittings should be allowed to actually take a vote on these particular matters. I think we are living in unprecedented times. COVID has really created a scenario whereby even our own politics and how we run processes which are prescribed in the Constitution, how they end up being done. But Kenyans will be eagerly watching and waiting to see how the Senate will handle this particular matter. It is important that we have as many senators participate in this as possible, so that we can get out any words which might be linked to bias and claims of bribery or influence that might have led an 11-member committee to decide on what the fate of the county governor of Nairobi will be. Nairobi is a very important county. The issues raised even in the motion are quite heavy, and because the issues of integrity, issues of blocking on transfer of monies and being able to render services. So these are weighty matters that need to be prosecuted in a manner that will allow for Kenyans to see that the Senate is taking this particular motion seriously.
Yeah. Now, we shall be keeping a close eye on that one because it is a hot topic and obviously a developing matter. So the papers, I'm sure, shall be having their thumbs on it. Now, let's take a look at the front page of the Standard this morning. We're told masters of doublespeak, and that has to do with the health crisis in the country within the 4th day of that strike. And the question is, who is fooling who? Not so long ago, President Kenyatta, DP Ruto, and ODM chief Raila Odinga swore to champion the cause for health workers, but it seems it depends on their relationships and political interest. Now poor patients, medics are dying as the trio flip-flop again. And when you read the article, it goes deeper into some of the championing of the rights of health workers that Raila Odinga has had. At some point, he even had a rally in support of them after union members were arrested and then released, and he promised to take the matter to the doorstep of Uhuru Kenyatta, who at the time he had called incompetent. But you turn to the page to date and the scenario is quite different, and the sentiments that are coming out of the same leaders are not the same as what they have said in the past for the rights of health workers. So when you see this article, when you read it, what came out, what spoke out to you?
I think the fact that the article was able to really show the contrast between how the leaders have changed in the terms of their positions since back in 2013 and what's happening today. Because we find that at one point, Raila Odinga seemed like the champion of health workers back in the day, and today, because of the handshake, he's been termed as an apologist to the government as it is. And while William Ruto, who was then the forefront fighter for the government position in terms of enabling service and ensuring that workers are paid and things like that, suddenly has become somebody who's now championing and saying, we know political processes should be put aside. Let's focus on what's important for Kenyans, and this is the issue of health. Now, when I look at this particular matter, and it's very sad because when you look, there's a story there that the NHIF CEO yesterday was saying that they're in 20 counties. healthcare workers, these are the clinic officers and everybody else, in 20 counties have not been given the enhanced NHIF package. That shows you how exposed that we are. Already doctors are claiming that they have not received PPEs, they have not received their pay, they have not received the NHIF, medical insurance covers. So it seems that there is some laxity somewhere. There's somebody who's dropping the ball. There seems to be that there is no consistent desire and need within government to ensure that health workers are really protected during this particular pandemic. And it even brings to question now how ordinary Kenyans should be able to react to this, who are members of NHIF and other particular things. So we are in a very sad situation. The front cover of the Standard shows that there's a young girl who died.
Yes, and I was getting into that. This is the human interest part of it. The Standard is bringing us the devastation. A 12-year-old girl died after waiting for more than 5 hours for medical intervention. And this happened at Kabaret Hospital, and later being moved to Eldoret as nurses and clinic strike continued. So this is just probably the beginning of what, or probably just the tip of the iceberg when it comes to the reporting of the cases of people suffering. And far from that, finally, the Standard tells us KEMSA is going to release the 5.9 billion coronavirus kits, and they're going to be sold at market price despite the loss that might incur as far as the government is concerned and how much was spent to acquire them. So this one it's devastating. A 12-year-old girl barely even began her life, and then she has to suffer because we have a government that could not handle the situation with the health sector appropriately.
And this is just not, it's happening all across the board. It's happening all across the counties. I've experienced this already. We have seen patients coming in from different parts, going to county referral hospitals like Mombasa, going into Nairobi, going into Kisumu, and they're finding that health workers are not there. People are being left stranded outside hospitals because there are no health workers who are willing to admit patients and take them in. This is the scenario that we're in, and I think as a country we need to take this as a serious priority. We need to put PPEs in the hands of health workers. I know it's been announced that these are going to be released, but how long did it take to just make this particular decision?
Yes.
We are at a loss. It's almost 6,000 shillings per loss per kit. But it's about time that we make sure that these kits are available to the health workers as soon as possible. When it comes to medical insurance for health workers, let's put that money in their accounts. Let's make sure that these health covers are provided for these particular health workers. We cannot be sitting around as a country saying that we're waiting for a vaccine to come and be the panacea to all these problems. The vaccine will not solve an issue that we can solve right now in terms of a country as leadership, that we need to put money in doctors' hands, let them all be paid. The ones who are in short-term contracts, let them be put in enhanced contracts so that they can be able to continue their jobs. And finally, let's make sure that at every single health facility, all the necessary equipment, health, medicines and things like that are available for these particular workers and also the patients. It's time we took health seriously. Let's not work around this double speak. People are now, even when you come to BBI, people are now saying we are now advocating for health because we want the health commission in the constitution, and we think we are saying this is putting words and playing around with a situation that is actually dire right now. What we can do is to say, let's allocate money right now, let's put it in the hands of doctors, and let's make sure that Kenyans are safe during this particular period.
Indeed. Now, speaking of that, we are told on the editorial cartoon right now, today on page 14, the communication is that there is a wrong prioritization, and there's a depiction of sick patients, COVID-19 positive patients in hospital, but there's a doctor or a health worker right there, or let's just say this is a representation of the leadership, who is trying to talk to the patient, and they say, vaccine? Nah, we are here to collect BBI signatures. So also just showing the state of the country where our priorities are seemingly is not right. But of course, this is yet another story that has been vastly covered in the Standard. Take a look at this paper, and find out for yourself where the country is at as far as this is concerned. Page 5 has a vast lots of image of the situation in hospitals, and it is not looking good at all. Let's shift gears to another story this morning that is that has to do with this is the door shut on Ruto Raila BBI changes. What do you make of this one on the front page of The Nation this morning?
You know, on this particular matter on BBI, I think the Secretariat went ahead of itself to put a pronouncement on a locking of receipt of changes in a time whereby not only is Dr. Ruto the one who's actually requesting for some changes to that particular document, but also ODM has also stated that there are some things that they would like to see added into it: the IBC matter, the Health Commission matter, the putting of the Independent Police Oversight Authority into the Constitution and locking it in. I mean, there are still things that need to be put in and incorporated into this particular document. Kenyans are asking for consensus. Yesterday, you will find that the Catholic bishops actually went ahead and said, look, we are not opposed to BBI, but there are some certain aspects that need to be incorporated into it, and Kenyans need to be listened to. I think it goes against the notion in which we are trying to build a country together, that when we are going to such a fundamental process, there are people and there are factions out there who are keenly interested in not allowing additional views into that particular document. I mean, still, it has been stated by some legal experts that, you know, until at that point whereby the actual bill called the Constitutional Amendment Bill that goes into Bunge is considered, this document is open for review and people can actually input what they feel it should be incorporated into that document. So I think this tough stance is stalling, and it's just stamping to show that this train has left the station, but I do not believe so. This is a train which can have as many stops as possible to allow as many Kenyans to board, and this is what most people are asking for. And I think it is only wise and prudent that a document as fundamental as this one incorporates as many views as possible. It's only right. And I think that statement by the Secretariat was too ambitious. And still considering the fact that we have not heard from the primaries themselves, that is especially His Excellency the President, of what is going to happen on this particular document, it is too early to call and say that there can be no further changes to that document. So I think Kenyans should continue ventilating on the issues that they feel should be incorporated, on the issues they feel that should be removed from that particular document. Let's continue having a national discourse on this particular document. That grandstanding should not be allowed in a Kenya of today.
Yeah. Now, let's shift gears also. It's December, and of course, we do know that, unfortunately for this country, you witness a spike in road accidents. So there's an article in relation to that on page 14 of The Nation this morning. It's talking about crashes. There's no escape for matatu owners when reckless drivers cause accidents that kill and injure road users. The court can still go after their employer. So it's not just about the person who was there driving. It would go further to the person who owns that, and perhaps giving incentive to those who own matatus to ensure that their employees are doing the right thing on the roads. What do you make of this, and do you think it would be effective in ensuring that there's a decrease in matatu-related accidents on our roads?
I think this is a fantastic proposal, and it's a proposal whose time has come. It's very important that matatu owners become responsible for the actions of their employee. They're vicariously liable in terms of law, because you see, you cannot allow drunkards, bank smokers, or people who are intoxicated to be operating your property, and out of the actions that happen out of that, you become immune, or you cannot be charged for the actions that have been undertaken by either the tout or the driver. So I think this is something that the time has come. It's very important that matatu owners vet the kind of people who they employ and how even they conduct themselves during that particular period of employment. And so for me, this is something that's very important. I'd like to urge also my fellow Kenyans and drivers out there, like, let's be cautious during this particular period. Let's reduce instances when people get behind the wheel after being intoxicated. Let's also make sure that we keep within speed limits, because again, it's a period whereby people will always seem to be in a rush, and yet they're all going on holiday. So it's time that we took time to really assess assess, do we really need to travel? And if we do, what timings are good? And let's get on the road and be disciplined about how we conduct ourselves during this particular period. Let's make this one of the Christmas period that has the least fatalities as possible. But it's very incumbent also upon the police to ensure that they maintain road safety, they do not look the other way. It's a time whereby we really need to keep numbers low. We are already suffering from a pandemic. It's important roads do not become another pandemic front for us during this Christmas period.
Absolutely. And far from that, let's take a look at gender-based violence. We're told violence against women as global COVID-19 crisis. A few months ago, the various organizations that keep an eye out on these incidences reported a spike in gender-based violence. This was based on the fact that the speculation that more women are spending more time at home because of the restrictions, and therefore this is a breeding ground for more and more conflict. So what do you make of this, and perhaps the efforts that we should all be making to ensure that this is reduced and looked at in a more focused manner?
I think this campaign came at a very important time and a very important period. I mean, it's important that our young daughters out there are kept safe. I mean, our young mothers who are also in homes that have suddenly turned violent to be in a safe space, because this pandemic has really created new stresses that were not anticipated before. I mean, there's a lot of strain in terms of economics. There's a lot of strain in terms of even how we are socially living, because suddenly we had children staying at home at very long periods of time. So we had as a country to really readopt ourselves into how we live with each other. And so indeed, it came as no surprise that there was a high increase in terms of gender-based violence. And for now, as a country, we should really create awareness out there that things can be solved without necessarily resorting to violence within the home and within our workspaces that creates this kind of scenario whereby we find these cases being reported. Also, I think it's also important that we as a country, and I like what the president did in terms of putting a focus on mental health during period following from the COVID pandemic. And it's important that as many institutions as possible, as many community groups as possible are empowered on how to deal with the rising cases of mental stresses that are coming about, or either owing out of the economic crisis or the pandemic itself, or even out of other scenarios that may evolve. So this campaign for GBV, it's a very important campaign. It should be supported by all Kenyans in all spaces, and we must do anything possible to ensure that we make our homes, our workspaces, our social spaces safe from this kind of violence.
Yeah. Now, far from that, excuse me, we're told in this article that 243 million is the number of women and girls that face gender-based violence and physical and sexual violence just last year. So the coronavirus seems to have just brought to the fore some of the issues that we have, but these are seemingly things that we gloss over. So what do you think we need to change? Because the coronavirus has just highlighted some of the problems that we already had. So maybe what can we change in how we approach gender-based violence, in your view?
I think the main thing that needs to be what we need to do as a society right now is to learn how to really communicate with each other. I think we've been really casual about how we operate in terms of how we deal with our things within our families, because we've not been able to talk to each other. We are now moving to a space whereby you cannot be able to communicate with your spouse, with your children, and you end up now resorting to violence to really communicate exactly what you want to say. So you see, it's a time whereby we really need to encourage people to talk with each other. It's a time whereby we need to encourage people to also learn how to interact with each other in different manner. I mean, we should have encourage people to have board games, things within the home that create some sort of engagement together, rather than just sitting there, Mzee coming in the evening, having his tea, going to sleep. After that, he leaves. You know, we had a society whereby it was very programmed in how different actors within the home are supposed to behave. And whenever anybody felt that his space has been intruded into, they resorted to violence. And this is what came about. So I think the reality is that even in our churches, even in the spaces where we go to interact beyond churches, even as we go to chiefs barazas and places like that, people should be encouraged to really learn to talk to each other. I'm encouraged because during this COVID, I'm seeing a lot of communities where men and women are getting married to each other. They were just cohabiting over like a period of 20, 30 years. And it shows that there has been some realization that how important spouses have become over time. So I think it is things like this that we need to really encourage within our society.
Indeed. Thank you very much, Alex Mwakesi, for bringing on board your opinions and a deep analysis of the various issues that have been covered this morning in the papers. And we look forward to having more of your contribution to the show. But speaking of gender-based violence, that is what we shall be talking about on the other side of this break. We'll have an expert panelist giving us a legal first-hand experience as well as a psychological analysis of why we are failing to handle this issue, and of course what we can do to ensure we eradicate gender-based violence in the country once and for all. Let's take a break and come back with more.
This is KTN News.
Naweza kurudi kwa